Hello, my name is Jessica Hannikin, and my speech is about communication between doctors and nurses. At the end of my speech, I would like my audience to understand the importance of effective communication between doctors and nurses. We have all heard the horror stories about tragic medical errors. Mistakes such as administering the wrong medication or dose, amputating the wrong body part, or mixing up patients and procedures can happen all on occasion, despite hospital protocols designed to prevent these errors. Far from being harmless, these mistakes can be financially costly and have severe health consequences for the patient. These types of mistakes can happen to any one of you while receiving medical care. Miscommunication between doctors and nurses not only affects the patient, but also affects the hospital and medical caregiver. Throughout the world, working in the healthcare field is considered very difficult and physically draining. Nurses and physicians, as professionals in the healthcare field, work to provide the best care for patients. Due to the work of the professionals as a team, communication is an important and essential component of care for patients with good quality. Today, patients and their families need to communicate with health teams to understand their health or disease. Communication as an important approach between nurses and physicians is associated with patient outcome. Communication between nurses and physicians has an effect on patient outcome and may be beneficial or harmful depending on the communication. Good relationships between nurses and physicians can help improve patient outcome. Therefore, understanding between nurses and physicians leads to more efficiently handling the patient's condition during intervention and treatment. Relationships that are based on respect between health professionals have a positive effect on the patient outcome. Verbal and nonverbal communications between nurses and physicians lead to sharing suggestions and opinions about patients' condition. Even though we strive to communicate efficiently with our teammates, miscommunications can always happen. Negative communications between nurses and physicians sometimes leads to tragic mistakes against the patients, such as medical errors. It is important that communication occurs in the most of the healthcare areas between professionals, especially in the complex areas such as the ER or the ICU, due to the limitations of time and rapid turnover. Most of communication between nurses and physicians in these areas are verbal. In the emergency room, which is a crowded area, a lot of concentration is needed because communication among health professionals may be lacking due to the patient's condition and time constraints. A 2016 study in the BMJ found that medical mistakes are actually responsible for more than 250,000 deaths a year in the United States. If medical errors were classified as a cause of death, which they currently are not, they would rank third on the list of deadliest conditions behind heart disease and cancer. According to the Joint Commission, nearly 60% of medical errors are a direct result of communication breakdown. Nurses attribute this belief to the perception that physicians are not always knowledgeable of nurses' scope of practice and the independence nurses have earned. The Joint Commission noted that physicians express frustration with nurses' communication style, describing it as a disorganization of information, a logical flow of content, lack of preparation to answer questions, inclusion of extraneous or irrelevant information, and delay in getting to the point. Miscommunication between doctors and nurses not only affects a patient, but also costs the hospital millions of dollars. Communication breakdown among nurses and doctors is one of the primary reasons for the patient care mistakes in the hospital. And since care quality is increasingly linked to reimbursement, those mistakes can be costly for both a health and financial perspective. Hospitals and doctors' offices nationwide might have avoided about $1.7 billion in malpractice costs and thousands of patient deaths if medical staff and patients communicated better, according to an article posted on a STAT website. And so how do we reduce these unnecessary deaths and costly fees? The answer is SBAR. SBAR, which stands for Situation, Background, Assessment, and Recommendation, is a model of communication among health professionals to assist a patient's condition and to provide the intervention. The goal of using SBAR is to share patients' information between nurses and physicians and also to facilitate the communication. SBAR process between nurse and physicians can be done through a phone call or face-to-face. Situation means the nurse must identify themselves and which department they're calling from, as well as the patient's name, age, sex, and reason for admission. Background means the nurse will inform the physician about the patient's complaint and relevant medical history. Assessment means a nurse will assist and inform the physician about his or her clinical impression of patient's vital signs and the severity of the patient's condition. Recommendation means the nurse will give suggestions to the physician and clarify expected action to be taken for the patient. SBAR is the most widely used communication standard used in the health field to document professionals' communication. Application and evaluation of SBAR was focused through literature for healthcare professionals to improve their communication and patient safety. SBAR is a tool used to improve the professional's communication and patient care. One study was done in the rehabilitation setting, used SBAR as a tool, and it showed improvements in communication within staff and increased safety reporting for patients. Medical errors due to miscommunications can result in costly fees, patient illness, and even patient death. Efficient communication between doctors and nurses is very, very important for the patient and also the hospital. Over $1.7 billion are spent each year on irresponsible medical errors. 250,000 deaths occur each year due to those errors, and 60% of them are a direct result of miscommunication. In general, studies have shown that communication has an important link with health caregivers, especially the nurses and physicians, and on the quality of patient outcome. Research shows that nurses and physicians must strengthen the communication between them in order to decrease medical errors, as well as to achieve the desirable patient outcome. Using communication models like SBAR might help nurses and physicians to structure communication between them. Hospitals and medical caregivers are supposed to help us, not harm us. Without more effective communication, medical errors will continue to happen.